Hi everyone, Dr. Anna Cabeca here. I am thrilled to be with you. I am the girlfriend doctor, and it's my mission and my passion to help women live better lives before, during, and after menopause. So, welcome to the Girlfriend Doctor podcast. It is an intimate place for intimate conversation, and I am here for you. You can ask or tell me anything for sure. And I've gotten so many questions lately about Alzheimer's prevention, dementia issues, concern about brain fog, some timers, and so much else going on. So I'm going straight to the experts in today's discussion on brain health as we age, especially considering Alzheimer's affects as much as over 2 times as many women as men. So we as women have to be even more proactive and taking as many preventive measures as we can, understanding the risk. Today, I'm bringing you a renowned physician, Dr. Dale Bredesen. He is an internationally recognized expert in the mechanisms of neurodegenerative diseases such as Alzheimer's disease, and he's the author of the New York Times bestseller, The End of Alzheimer's, published in 2017. And his newest release in 2020, The End of Alzheimer's Program, the first protocol to enhance cognition and reverse decline at any age. The principles in here, if I don't say so myself, are quite keto green. It's nice to really just see this in print, plus so much additional information he's given, especially where it comes to the health of our brains. Dr. Bredesen, he held faculty positions at UCSF, UCLA, University of California, San Diego, and directed the program on aging at the Burnham Institute before coming to the Buck Institute in 1998 as its founding president and CEO. They're doing some amazing work at the Buck Institute, and I really am thrilled to be talking with him today. So I know you'll have questions and comments and definitely want to share this episode. So join me in welcoming Dr. Dale Bredesen. Welcome, Dale, to the Girlfriend Doctor podcast. It's nice to have you here, Dr. Bredesen, with all of us and my audience. We have been wanting to hear from you for so long.
Thanks so much, Anna. Thanks for having me.
Well, first, congratulations on this amazing book, The End of Alzheimer's Program.
Thank you very much. I really appreciate it. After the first book, everybody was asking for details, workarounds, websites, where do you go, how do you cook it, what do you do, etc. And so very excited. Worked actually with Julie G, who is a user and biohacker who's doing tremendously well herself, and also my wife, Dr. Aida Lasheen Bredesen, who is an integrative physician. And so we had a clinician and a scientist and a user, a daily user, and we got a really different look at how do you do all this? How do you make it practical?
Well, and it's very practical. It's fabulous reading. It is fabulous reading because you also infuse humor. You also, that I've enjoyed that in the titles of everything. I mean, just so much creativity, humor. And I have highlighted all through the book too, just with such good information as well as graphics. Now we do have something in common. I don't know if you know this, but Dr. Perlmutter also wrote the foreword to my book, Keto Green 16.
I did not know that.
That's nice. I mean, he's one of the people that I admire most in the world. I've been following his work for over a decade and have just been thrilled. Now you are not new to the study of brain health and Alzheimer's. Will you give your history a little bit for us?
Sure, yeah. So I trained as a neurologist and neuroscientist, and we spent 30 years in the laboratory, published 227 papers, and the whole idea was the area of neurodegeneration, as you know, is the area of greatest biomedical therapeutic failure. As they say, everybody knows a cancer survivor, no one knows an Alzheimer's survivor. So it's really been difficult. And so the idea was I wanted to go into the laboratory full time, and which we did for 30 years, as I mentioned. And the idea was, could we understand the molecular underpinnings of the degenerative process? Why do you get Alzheimer's? Why is it so common? Why do you get ALS? Why do you get frontotemporal dementia? And as we went along, we started to see something very different about this disease. People have been saying, let's get rid of that amyloid, let's get rid of that amyloid. But that's actually not how the disease works. This disease, as I mentioned in the book, is really a protective response. You make that amyloid because it is antimicrobial. It kills bacteria, it kills spirochetes, it kills viruses, it kills fungi. So you're really protecting yourself. And you know, Anna, what really came out of this, it was so interesting. It's very much like what we saw with COVID-19. So with COVID-19, what did they tell us? They said, get indoors, you want to social distance, you want to shelter in place, don't get out there because you have an insult, in this case, SARS-CoV-2. Well, in Alzheimer's, you have an insult as well, but it's any of many different insults, from insulin resistance to herpes simplex to P. gingivalis and on and on. And your brain is saying, okay, we have an insult. I'm going to spew out this amyloid because I'm trying to deal with that insult. But in so doing, I am downsizing. Just as we've ended up with a recession in the US because everything has downsized, that's the problem in the brain, very much like COVID-19. And so the brain actually downsizes in response to these insults. So if you're going to treat this, you have to first figure out what are the insults for each person that are driving this. And then you've got to get rid of the insult and then begin to build back. You're really changing a synaptoblastic to synaptoclastic ratio, much as you would do with osteoporosis, where you want to increase the osteoblastic activity and decrease the osteoclastic activity. This is synaptoblastic and synaptoclastic, but same idea. And so that was the whole goal of the lab. And it took us 30 years. Unfortunately, I was slow. And we finally got to the point where we could start to see, okay, maybe we could translate this into something for humans. We worked on mice, we worked on cells, we worked on fruit flies, all of this stuff. And then I was really excited to see the very first patient back in 2012 actually get better. And I was just shocked. I thought, whoa, wait a minute. You know, we're going in the right direction here. So now there are thousands of people who are on the protocol, and it comes directly from the test tube.
Well, and then some, right? Those initial experiments and individual cases, and just that skill of observation. Okay, what we're doing is not working. This,
Right.
you know, attacking the amyloid or targeting drugs for amyloid, and you put like this cemetery in the book, like this picture of the cemetery. It's all the drugs that have been used for
Yeah.
Alzheimer's, right? And
Yeah.
what we see, and this is what's really interesting, because you talk about this recession, right? This shrinkage, right? It's the brain is starving because of insulin resistance, as well as, you know, chemical toxicity and other pathogens, and addressing oral health and oral, you know, microbes in your book. And I've seen very few other resources address that. And I think that's just such an important part of health, and to see it tie in directly to Alzheimer's.
Absolutely. And that's the thing, that there are dozens and dozens of these different contributors, and you've got to sort them out, identify them, and attack those while you are building things back. And of course, hormonally, trophic factor wise, nutrient, as you mentioned, starving, we find a lot of people who have low nocturnal oxygenation. In fact, there's a wonderful study that showed a direct correlation between your mean SpO2 while you sleep. So wherever you are, you should be up at 96 to 98, but so many people are down at 92, 90, 88. There's a direct correlation between that and the size of specific nuclei within the brain. So as your oxygen goes down, so does your brain volume.
And also that, you know, decrease in quality sleep is associated also with insulin resistance and
Absolutely.
obesity and these issues. I've got to read this one paragraph from your book. May I?
Please, yeah.
Okay, by Dr. Dale Bredesen, right from our book, The End of Alzheimer's Program. So I love this chapter. So just as there were global projects to vaccinate against smallpox, so should there be global projects to prevent and reverse cognitive decline utilizing the 21st century vaccine. This is the way to eradicate the very illnesses that are killing us today: complex chronic diseases such as Alzheimer's, Parkinson's, macular degeneration, cardiovascular disease, hypertension, type 2 diabetes, cancer, and on and on. These should all be and all can be rare diseases instead of the ubiquitous contributors to our ill health that they represent today.
Absolutely. And as you know, we did very well as physicians in the 20th century going after simple diseases like pneumococcal pneumonia, tuberculosis, diphtheria. Those are really past scourges. And the idea of this book is that Alzheimer's can be and should be a past scourge. This will ultimately be registered as really mainly a 20th century disease because of all the exposures we have, because of all the things that we're doing incorrectly, because of all the various things that we're not identifying and treating. When we do that, this should be a past disease. But as I mentioned, it's not a vaccine like you go get an injection. It's a personalized precision medicine program that we talk about there because you have to go after the things that are actually causing it. I mean, how crazy is that? People have been trying to treat Alzheimer's for years by giving something that is a predetermined single drug. So if you think back to the 1600s and the 1700s, people died all the time of the diagnosis fever. So they'd say, oh, what did he die of? He died of fever, or she died of fever. Well, what would you do if you were trying to develop a drug for fever? I mean, you might think about penicillin, you might think about aspirin, you might think about water. Maybe this person is dehydrated. I mean, there are dozens of things you could think about, but it's different. Fever comes from different places, and that's the same situation we're in with Alzheimer's. It comes from all sorts of different contributors. So the idea of blindly throwing a single drug at it really makes no sense.
No, not at all. And I think that's, you do state that so well in this book with so many examples. I mean, I just have loved also the images again that you talk about. But it's, addressing the multiple targets, the multiple foci, and to address like, creating the end of Alzheimer's. Like what are the steps that we need to take to create end of Alzheimer's, and why? And I love this area of research as far as the woman's brain, why women, I would love you to address this, Dr. Bredesen, why women have over twice the risk of Alzheimer's as men.
That's a very good point. And as Maria Shriver has pointed out, this is a woman-centric disease. Women represent, as you said, about 2 to 1 for males. It's the opposite for Parkinson's. It's about 1.8 to 1 for men. So women represent about twice as many of the patients, and they also represent about 60% of the caregivers. So they are really disproportionately affected. And there are a couple of reasons that may be the case. Nobody knows for sure, but part of the answer seems to be that when you change hormonal levels, so again, as you said, this is an insufficiency was what it comes down to. You don't have enough of stuff, hormones, nutrients, trophic factors, to support the demand of these 500 trillion synapses that you have inside your skull, just an amazing supercomputer. So with men, as you know, the androgen tends to go down like this over the years. With women, for many people, the estrogen tends to go down like this. So there is a relatively sudden loss. And that is one of the things that seems to enhance the likelihood. And then no surprise, if you have BHRT at the appropriate time, in fact, you reduce your risk quite remarkably. And unfortunately, of course, with the WHI results from years ago, everybody's very afraid about that area. But there's no question, there's studies from Stanford and numerous other places. And Dr. Ann Hathaway, who works with me on the town halls, is a real expert in this area and shows that, in fact, if you have BHRT, your risk goes way down. The other thing that's been interesting is,
Let me just clarify for listeners, BHRT, bioidentical hormone replacement therapy. Right?
thank you.
Bioidentical. That's key. Key word there, BHRT. Thank you, Dr. Bredesen.
Absolutely. So you're really preventing that sudden decline that otherwise happens. And then the other thing that has come up is we've seen many, many people. It's interesting, when I was training, I never saw people in their 50s with Alzheimer's disease. We would see people in their 70s, 80s. We used to think of this as a disease of your 60s, 70s, and 80s. It's really a disease that starts 20 years before that. So it's really a disease of your 40s, 50s, and 60s that we diagnose 20 years after that. But now we're seeing women especially in their late 40s, early 50s, so many 52-year-old, 53-year-old women who come in with very significant Alzheimer's disease. And what turns out is that when you, as you know, when you go through menopause, you have this osteoclastic burst. So for about 7 years or so, you are now releasing the very toxins that you have sequestered over the years in your bones and other organs. You're now re-releasing these back into the bloodstream. So your mercury level can bump up again, your organic toxin level can bump up again, and other toxins that can bump up during that time. Furthermore, as you know, the progesterone often goes down more so that you have this estrogen dominant period. And progesterone is a critical part of your detox apparatus. So when your progesterone goes very low, you are now losing that nice ability for detoxification. So for all those reasons, it seems that this is a more common problem in women.
Well, I have found this has been so interesting for me, and I share these stories in my books, The Hormone Fix and Keto Green 16, just from my, like at, my second menopause, I'll say was at 48. I'm 54 now with a 12-year-old. I'm on the road with her on the rodeo, by the way. My people that have been following me on social media, we've seen a lot of horses lately. And so, but at 48, I was really struggling with that brain fog. I had
Yeah,
the weight gain despite not doing anything different. And I had the
yeah.
brain fog, which, as a physician, relying on my really good memory to have such a like cognitive impairment, honestly, is probably was more distressing, or at least as distressing as the weight loss, as the weight gain and hair loss. So that's a terrible thing to experience. But what I found, and the same thing, like stumbling into my Keto Greenway, like your Keto Flex 12-3 program does even more, is just recognizing that critical importance of shifting from using glucose for fuel to ketones for fuel, and then finding some research that was published in 2016 that showed that gluconeogenesis in the brain and the muscle and is estrogen dependent. But and so we're actually starving, women's brains are starving for fuel from the hormonal decline we're experiencing. So it's a fuel problem for during this transition, as well as the increase in toxins.
And this is one of the things that we're seeing frequently that really hasn't been dealt with sufficiently in the past in a standard medical care. So what happens, think about if you have an outpost. So Dr. Anna Cabeca, now you've got your right-hand person and she is out, in Alaska somewhere. You have got to get to her. You've got to get food, you've got to get water, and you've got to make it all the way there. You can't drop it halfway off. It's got to go all the way there. So the same thing is happening in these brains. You have to have the blood flow to get there. And so many people are not getting it. They're not getting the blood flow to these. They've got some vascular disease. They've got a sedentary lifestyle. They're simply not moving the cargo. Second thing, you've got to have the oxygen there. And I mentioned that earlier. But this is true during the daytime as well as the night. You've got to get the oxygen there. And then the third thing is you have got to get the ketones there. So you've actually got to get fuel. And of course, you also have to have trophic factors and hormones and things like that to make the system work. What's happening with so many of these people is they're not getting that combination there. So what happens? The brain says, okay, I'm going to have to live as a little bit smaller brain. I'm going to have to give up some of these synapses. And so we just see people are downsizing. They can't remember the things they used to. They may have some brain fog. They can't do the calculations. They can't learn new things the way they used to. They can't organize the way they used to. We see the people presenting to us either with an amnestic approach, which is about 2/3 of the patients, or a non-amnestic, where they have executive dysfunction, problems with recognizing faces, things like that, word finding issues, stuff like that. So this is a critical piece, and you need to make sure for each person that they are getting the appropriate nutrients, the appropriate blood flow, the appropriate oxygenation, the appropriate hormones to the entire brain.
And, and I love the work that Dr. Lisa Mosconi is doing also on the
Yeah.
XX brain, really looking at this. This is my argument, and I discussed this with her too. I interviewed her on my podcast a while back. But if you look at that dip in the onset of symptoms during this perimenopausal time period,
Right.
with the insufficiency of glucose metabolism in the brain, you cross over those two diagrams, what you see in this age, 35 to 55, that's your period of neuroendocrine vulnerability. It is young.
Yes.
It is super young. When we look at this, and also you said too, those symptoms that we're experiencing, they're neurologic symptoms as well as the gynecologic symptoms. So everyone listening, your gynecologist needs a neurology, read. They need this book, The End of Alzheimer's and The End of Alzheimer's Program, both your books. But I get so passionate about this because it was such a missing link for me to look at this neuroendocrine time period, the insomnia, the anxiety, irritability, the increase in divorce, y'all. I mean, physiology of divorce, there is one. So, this is all happening during this time when the brain's, is struggling with these areas, not just, right, the glucose utilization, but also are using, shifting from the insulin resistance in the brain, okay, right? And getting the blood flow there, the oxygen there, improving the circulation to the brain as we need to all other areas of our body as well. But my big thing is that dip, that decline in glucose utilization in the brain follows the decline in progesterone. And since progesterone is a neuropeptide, is progesterone better? Would it be preferential than estrogen to start with, in your opinion?
That is a great point. The fact of the matter is the data so far, and I would defer to Dr. Mosconi, who's a far great, and to you, far greater experts than I am in this area. But just from the standpoint of biochemistry and from the standpoint of what your brain needs, it turns out that the studies suggest that estradiol is actually, if anything, more critical than the progesterone. Now, the progesterone, definitely for people who have toxic burdens, progesterone is critical. But in general, for memory, for supporting synapses, estradiol is actually more important. And interestingly, what happens, you can follow the molecular pathways. So the estrogen, as you know, binds to its receptors, and these then this complex enters the nucleus and affects the production from hundreds of different genes. And interestingly, one of the genes that is upregulated by your estrogen in binding to your estrogen receptor is the alpha secretase, the very one that comes back and cleaves the amyloid precursor protein, the APP. So when this APP is sitting in your brain, this is literally a molecular switch. When things are good, it is cut at the alpha site. You get two pieces, one for outside the cell, one for inside the cell. And they literally say, things are good, Anna. Go ahead and make new synapses, grow. You're going to make new memories. You're going to keep memories, etc. When things are bad, ongoing inflammations, pathogens, toxins, poor hormone support, etc., it gets cleaved at three different sites, beta, gamma, and caspase sites, producing 4 fragments, 2 for outside, 2 for inside, that come back and say, you've got to pull back. We are under assault. And just as you would in a country, we're now going to pull back and protect ourselves, just as we're doing with COVID-19. So estradiol has a direct impact through the alpha secretase to produce those 2 fragments that are all about growth of synapses and maintenance of synapses. So definitely, now, again, they're both important. But if you had to say one, then certainly for memory, it would be estradiol.
And this is where, because, look at the research in this and then, compare that to my clinical experience. I know I always want to put a red flag when someone says that, but in working with women with bioidentical hormones over the decades, when I had patients who had had a hysterectomy and they only came in on estrogen, right? Even estradiol, other than Premarin, right? We had them on estrogen. And I added progesterone. Universally, everyone came in and said, I feel like a fog has lifted.
Yeah.
I think better, I'm clearer. And
Yep.
so
You need both. And we ran into the same thing, by the way. One of the very first patients who went on this protocol, it was the one issue, she said, well, I'm a little bit better, but things aren't great yet. And it turned out she had a very high estradiol to progesterone ratio. So she basically had progesterone insufficiency. And when we simply balanced that and gave her the appropriate ratio, she said, oh yeah, the fog is lifted. I'm so much better now. Now, interestingly, she showed up a year later and said, wait a minute, things are not so good again. And it turned out that her estradiol had been changed from transvaginal to transdermal. And when it had been changed, nobody bothered to check the levels. her level on transdermal was 0. And she, interestingly, she kept a diary, and she could show about a month after she switched to the transdermal and was just unfortunately not getting any absorption. She ended up having some cognitive decline again. So you really do have to follow the levels. You really do have to make sure that people are optimized. And as you said, getting that correct ratio, having both, is really helpful, especially I think for people who are trying to detox, because it's such a critical part of that.
Yeah, and I want to talk more about progesterone and detox too, because I love bringing this in together. And just to let clients know too, we're talking about bioidentical progesterone, not
Right.
progestins. And
Right.
there are many varieties of progestins, pregnane, norpregnane, maybe a whole bunch of derivatives. But regardless, they're synthetic, they're not identical to progesterone. And that's what we really want to address. And there are bioidentical prescription forms like Prometrium now, it's generic, so bioidentical progesterone and compounded forms of progesterone. So orally, transdermally, vaginally, those are ways to have it, and I recommend that as part of a healthy hormonal profile, especially for those of us over 50. I'm like, who needs progesterone? Pretty much those of us over 50, for sure. If we're not on it by then, I don't know. What's your opinion, Dr. Bredesen? We always want to treat individuals individually, but
Yeah, I have to say, from everything we've seen neurologically, I'm a very strong believer in BHRT, and starting it, right around the time of perimenopause or menopause, and continuing. And the big issue has been, what if no one started and they come in and they're 70 and they're having cognitive decline? And I know this is a controversial area, and we always say of all the areas, this is probably the most controversial. And Dr. Hathaway, who has really studied the literature carefully, argues that in fact it can be helpful for cognition even into your 70s, 80s, and 90s. So her argument is that actually this is, with respect to cognition, and again, remember, we're not dealing with someone who's asymptomatic. We're typically dealing with someone who already has some symptoms. Unless they're purely for prevention. But as you indicated, you can see changes on the PET scan in the 30s and 40s. So we always think of this as an energetic emergency. There's an ongoing problem. It's as if you're being strangled lightly. You have got to do something about that. Don't sit around and wait for the strangling to get worse and worse and worse. So you have got to reply to that and respond to it. So yeah, I have to say I'm a big fan of the HRT. I recognize there are issues, there are side effects that can be there, and of course, there are ways you can take care of this. And a number of people have said to me, look, I'd rather check myself and make sure that I'm not developing, for example, a tumor, and have better cognition than to allow myself to descend into Alzheimer's disease. And I think it's a fair point.
yeah, it is a fair point. And I like how you said energetic emergency, because we're energetic beings and our neurotransmitters are energetic molecules. Our hormones are energetic molecules. I always say we're just beginning to understand hormones because they're energetic molecules, and we really don't have a perfect way of testing them. That's why we look at blood, saliva, urine. We're looking at everything, right? We want to look at hormones everywhere. So I think that's an important point to make too.
Right, exactly. And this is, our mitochondria are trying to do the best they can for us as our batteries, basically, to keep things rolling. But if we're not optimizing them, if we're not getting the right fuel to them, if we're not getting the right trophic support, I mean, interestingly, the amyloid beta itself is a mitotoxin. So it's actually turning down. It's really saying to you, we're going to pull in everything. We're going to try to live with a smaller brain. And as long as you don't address those things that are causing this, it will just keep doing that and say, okay, smaller brain, smaller brain, smaller brain, till, as you know, you get to the point you can't dress yourself, you can't speak. It's really horrible to see this. And to watch people watching their patients go downhill without even checking these things just kills me.
I was just wanted to laugh when you said you can't dress yourself. I know I'm in like a t-shirt today, Dr. Bredesen. I'm kidding.
That's
I know.
COVID-19 related. That has nothing to do with your mitochondria.
That's right, right? I gotta keep my mitochondria healthy.
Exactly.
But it's so true. And these limitations start in many ways. And it's never, I love what you said, 70s, 80s, 90s, it's never too late. I've had clients on hormones in their 90s. And so, but naturally, like my clients over 50, I'm switching to transdermal, transvaginal, transdermal, I mean, or injected,
Yeah,
but bypassing the oral route. Or sometimes I do troches as well in a healthier clients.
yeah. Yeah, these are all critical, obviously. Again, we can literally see this synaptoblastic to synaptoclastic ratio, the ability to make and keep synapses versus the pulling back. And we're all pulling back. It's a normal thing where you're saying, okay, you're going to forget actively the seventh song that played on the radio on the way to work yesterday. We're keeping our most important information. And what's interesting, someone asked me years ago, why is it that memory goes first in these people? That's such an important thing. But if I said to you, okay, Anna, you're going to wake up tomorrow morning and you can either lose the ability to speak, the ability to do your work, calculate, figure out new things, or you can forget the Friends rerun from tonight. It's an easy choice. And so your brain has collected so many important memories that this is one of the reasons that Alzheimer's takes so long for a diagnosis, because you can function so well with what you've already learned that the first thing that is sacrificed as you're now downsizing is the ability to learn new things. So that's really the canary in the mine. Anyone who's having trouble learning new things in any way, jump on this, please get evaluated, get on optimal treatment, because people who are early on, very easy to treat. And we see all of those people, virtually all of them, reverse improvement in their symptoms.
And that's so encouraging, because I know it is something that people really worry about. And that's where we're going to go into your program some more. But this is an area where ApoE carriers, we can talk about that. And where we're afraid of ketogenic diets. And yours is definitely a ketogenic, a healthy, very healthy ketogenic approach. I do want to go some vocabulary real quick too for our listeners. Trophic meaning hormonal related. And one thing you said earlier was about with menopause, you have this osteoclastic burst, So can we talk about that too? The breaking down, eating up, demineralization process that we're experiencing, and how that plays into Alzheimer's again, please?
Absolutely. So just imagine you've got a house and you've got contractors who are doing only the building. Those are the osteoblastics guys, osteoblasts. And then you've got contractors that do all of the demolition. And imagine that for 20 years, the ones that did the building never showed up. The ones that did the demolition always did a little extra for you. Your house would shrink, shrink, shrink. That's what happens to your bones in osteoporosis. And it has what happens to your brain in synaptoporosis, which is Alzheimer's disease. Alzheimer's disease is a synaptoporosis. And some of the same things, like estradiol and progesterone, are involved in this. And by the way, vitamin D, another good example. Vitamin D, very important for osteoporosis, very important for Alzheimer's disease. And in fact, people who have specific SNPs in the vitamin D receptor have an increased risk for Alzheimer's disease. People who are very low in their vitamin D have an increased risk, not only for poor outcomes with COVID-19, but also for Alzheimer's disease. So these are all critical. And you mentioned trophic as hormonal, and yes, anything that supports growth and maintenance. And there are non-hormonal trophic factors, nerve growth factor, brain-derived neurotrophic factor, things like that. And then, of course, there are also nutrients that are important, that are trophic in their activities, like vitamin D, like vitamin B12, things like that. And anti-nutrients, homocysteine, which as it goes up, your brain shrinks. So again, these are all targets. And in fact, high homocysteine, another risk for Alzheimer's disease, another thing that should be addressed.
And I think that's key. There's so much, I could keep you on all day for sure, and I'm going to do the best I can to let you go at some point. But one thing that you wrote in your book, and I also do recommend testing in my books, The Hormone
Yeah.
Fix, but I love that you put target values here. And what I was surprised with homocysteine, because I always thought optimal homocysteine is 6 to 8. So, 6 to 8 is the optimal homocysteine, and you put in less than equal to 7 micromoles per liter.
Yeah. And 6 to 8 is so close. I don't worry about that. I worry about the people who show up with 12, 15, 20, 30. And we've seen all of those. And here's the thing, the reason I put less than 7, this is, and I think I referenced that, so there's a wonderful paper from the UK that showed literally they followed people over years. And what they showed was a beautiful correlation, unfortunately. As your homocysteine hits 7 and above, and it really goes up when it hits 13 and above, the rapidity over the years with which your gray matter declines and atrophies goes up directly. So the higher your homocysteine is, the more your gray matter is shrinking over time. And then they did the really nice study of saying, okay, what if we brought everyone down to 6 or 7? And so you can do that, of course, with methylfolate, with methyl B12, with P5P, those sorts of things. So they brought everybody's down, and then they continued to follow them, and they saw no further atrophy. So it really was a nice compound study where they're looking both at association and causality, and just showing that bringing that down. So that's why we say, try to get it below 7 if you can. That's from the UK study. But we don't worry about people who are at 7 or 8. It's so close. We worry about the high ones, and we see it all the time. And so you need to address that because it has multiple mechanisms, high homocysteine, multiple mechanisms by which it helps to shrink your brain.
Yes, yeah, and just a big shout out, anyone who's had, preeclampsia or eclampsia, make sure you've checked your homocysteine levels as well as something called ADMA, because that, is also a marker of methylation defect and can increase your risk of Alzheimer's. I want to just go over those treatments because I know I'll get this out. People will be writing into me. So for a high homocysteine, methylated folate, not folic acid, right, Dale?
Right, exactly. So you want methylated folate, and people use anything up to 15 milligrams. We usually recommend anywhere around 1 milligram. You could go up to 5 if you want. In the British study, they used 0.8. So all of those are in the ballpark. The main thing is follow up your homocysteine. Make sure you're having the appropriate effect. Now, I should mention there's a big caveat here. Occasionally, it's not terribly common, but it's typically with people with COMT SNPs, as you know, which have poor metabolism. You don't have the appropriate hydroxylation, basically, so you're not metabolizing appropriately. They can actually have hypermethylation. Now, the difference is they usually don't have high homocysteines, but for those few people who you may find that if you now go on the methylated folate and methylated B12, you get some anxiety. And if you do that, fine. Just switch to hydroxycobalamin and use the non-methylated forms. It's not a big problem. But if you do happen to know that it's not terribly common, but we run into it every now and then.
Yeah, yeah, no, I agree. And then many people getting B12 injections are getting cyanocobalamin.
Yes,
Can I talk
yes.
about that?
And again, yeah, we recommend methylcobalamin. And
Thank you.
typically you want to be around 1 milligram of methylcobalamin. That typically gets your levels up. And the levels you want to get, and this gets back to what you said earlier, which I think is such an important point, which is that what people have told us is within normal limits means nothing. All it is statistical. So you take the mean, you take a lot of people, you measure them, and you say, we want you within 2 standard deviations of the mean. That has nothing to do with physiology. So physiologically, we want the optimal. And we don't, in some cases, we don't know the optimal. So we want to at least get you to the mean, or if it's a positive effect or something above the mean. And simple example, where if you look at B12, great example, where the norm is 200 to 900. Now they've adjusted that a little. Now they're coming up a little, but they also say under there, be careful, you can actually get diseases. So you can die of pernicious anemia with a normal B12, for example, of 300. So it's clearly not optimal if someone can die with that level. Clearly, we want to make sure that people are above 500 on their B12 levels.
Yeah, no, I agree. And don't, for listeners, don't expect your insurance company to um, pay for much of this that we're talking about, because let me tell you, I had the experience in medical practice where I was giving methylcobalamin shots to clients to optimize B12 as well as treat neurologic issues, hormonal imbalance, support detoxification. And Blue Cross Blue Shield, that big old provider, came and basically told me that giving B12 injections for anyone who's not diagnosed with pernicious anemia, they could say that I'm practicing a fraud, like fraudulent medicine. And it was shocking. I was like, could you please say that again? And the same with repeat vitamin D testing. So many of us in the functional medicine space have gone to cash-based practices because we don't need big box, companies telling us how to practice medicine when we're doing this. And that was, maybe they've changed their mind. That was 2010. So, but it's infuriating. I love how you say in here target values or optimal values, target values. The other, and you've got so many great, you cover all the tests in here, but also you talk about hemoglobin A1c, and I kind of wanted to protest this one. I always say 4.8 to 5.3. You dropped it down to 4, and I like my metabolic flexibility, my feasting.
Yeah.
So like I have 4.8.
Yeah, no, and again, what we're saying there is great to be at 5.0, great to be at 4. Those are absolutely fine. And I think we took it in there up to 5.3. So yeah, great to be in that range. We're just saying there are a few people who then wrote in and said, well, wait a minute. When we mentioned this before, they wrote in and said, well, wait a minute, I'm doing everything right and mine's at 4.5. I'm not okay. No, you're fine. So there are going to be those few people, but you're right. Listen, when I see someone at 5.0, 5.1, I'm thrilled. That's where we love to see them. But if we're not going to get upset if someone's way down at 4.5, they happen to be really strict, great. The ones I worry about are the ones who say, well, I'm at 5.6 and my doctor said that's fine. That's not fine. You're right there knocking on the door of prediabetes. You are, and especially looking at your HOMA-IR, that's another big one. So, you can simply take your glucose and take your fasting insulin and multiply those, divide by 405.45, you'll get what's your HOMA-IR. And we like to see people around 1.0 as they're drifting up to 2 and 2.5, even 1.7, 1.8. They are becoming insulin resistant. And as you indicated earlier, your brain is dependent on this insulin. For the years and years, we grew brain cells in a dish. You always had to include insulin in the dish to get them to survive. Insulin is such a critical growth and survival factor for brain cells. So as you become insulin resistant, you can actually see that biochemically. You change the phosphorylation pattern of your IRS1, your signaling molecule, downstream from your insulin receptor. What does that do? It turns down the response. So as you indicated, you really get resistant to this, and you don't have that nice trophic support that is normally provided by insulin.
Good stuff. So much good information. Now, I wanted to talk about ApoE because we have clients that have ApoE and they say, well, can I do, in my program, can we do keto green? Can we do keto? And you talk about that in your book too.
Yeah, it's a great point. And ApoE is something that everyone should be aware of. And again, everything's been turned upside down. People have said, the standard of care, no reason to check your ApoE status because there's nothing you can do about it. Nothing could be further from the truth. There is a tremendous amount. The armamentarium we now have for prevention and reversal of cognitive decline, both in ApoE4 positive individuals and negative, is huge. So everybody should know. So here's the thing. ApoE is this remarkable thing. It was thought to be like your butcher. It's the guy that carries around the fat, right? It's a apolipoprotein. So it is a protein that carries fat globules around to your body. Now, what the heck does that have to do with Alzheimer's disease? Well, it turns out to be a remarkable, remarkable gene. Our simian forebears did not have ApoE4. They had ApoE chimp, basically. And as the hominids appeared between 5 and 7 million years ago, there was this new ApoE with mutations, changes from previous. And there are specific mutations that allow this to be more pro-inflammatory, unfortunately. So what happened when we went from simians to hominids, we became more inflammatory beings. And as has been pointed out by Professor Tuck Finch at USC, this is probably because we came down out of the trees, we're walking around on the savannah, we're puncturing our feet, we're exposed to microbes like never before, we're eating raw meat, which otherwise would give us all sorts of pathogens. And interestingly, in third world countries, you still live longer if you've got ApoE4. So that's the primordial one. That was the original ApoE. That now, if you have 0 copies of that one, so everybody's got 2 copies of something. There's ApoE4 ApoE3, which just occurred 220,000 years ago, and ApoE2, which just appeared 80,000 years ago. Now, most people are now ApoE33. That's what I am. For example, I checked myself, but 75 million Americans, so about a quarter of the population, has one copy of ApoE4. 7 million Americans, about 2% of the population, just over 2%, has two copies. If you have zero copies, your chance during your lifetime of getting Alzheimer's disease, about 9%. It's not zero, but it's relatively low. If you have a single copy, it's about 30%. If you have two copies, it's well over 50%. More likely than not, you will develop Alzheimer's. Okay, none of these people should develop Alzheimer's. We need to get everybody on prevention, and this is why it's great to check. Now, as you mentioned, it changes your metabolism. And what we discovered and published a number of years ago in our laboratory experiments, this stuff that is thought to be your butcher that carries around the fat, guess what else it does? It actually goes inside the nucleus of the cell, binds to pro-inflammatory factors such as REL-A, and changes the production of 1,700 different genes. So the guy that we thought was your butcher is also your senator. He's also making the laws of the land, changing the programming of your entire cell. So it's an incredibly important protein that's moving around here. Now, what you alluded to earlier is people often question, should I get on a ketogenic diet? Because they don't want to take fat. All right, here's the trick. It's fine to have monounsaturates and polyunsaturates. So what you want to do is you don't want a bacon-rich ketogenic diet. You want a plant-rich, just like keto green. You want a plant-rich ketogenic diet. And by the way, you also want the fiber that you get from those plants. So that is fine. And again, we have one of the three authors with me on this book, Julie G, is an ApoE4/4 herself, who has monounsaturates, polyunsaturates, eats a plant-rich ketogenic diet, and has fabulous lipid numbers and fabulous hemoglobin A1c. She's doing absolutely great. Now, for those who are just starting out, just take some exogenous ketones. You want to stay away from coconut oil if you're ApoE4 positive, and just take some, you can take ketone esters, ketone salts. There's one that I happen to like, which is called KE1, but whatever you like, take some exogenous ketones. And then in the long run, we want to get you on endogenous ketosis to be able to generate them from your own fat, because that has some advantages that you don't get with exogenous ketosis.
Let's talk about that, because I always hear and I say, well, exogenous ketones as a crutch to get you sustaining your intermittent fasting, to help with hunger, to improve willpower, but not for the long haul. So can you talk about that too? And thank you for the discussion on ApoE4 and, in this area, like the fear of elevated lipids. And I would say, let's watch it. We're going to watch and follow this plan. Let's watch it, because pretty much universally, I've seen improvements in fatty liver, improvements in lipids, improvements in just all the way around the board. So.
Absolutely. And one of the things that we've noticed with people who go on the protocol that we have for cognition, they actually get off their antihypertensives, they get off their statins, they get off their anti-diabetic drugs, so that they get rid of their metabolic syndrome related problems. So they are doing better with burning of fat. And as you indicated, it's best to have endogenous ketosis. But at the beginning, the point is, as we talked about earlier, this is an emergency. Literally, your brain is being strangled. So we want to get the blood flow, we want to get the oxygenation, and we want to get the ketones there. We want to support that. You can literally see on a PET scan, the hallmark of Alzheimer's, when a neuroradiologist looks at your PET scan, is to say there is reduced glucose utilization in your temporal lobe and your parietal lobe. That L, that is the hallmark of Alzheimer's. And in ApoE4 positive individuals, those changes can begin in their 20s, even though the diagnosis may not occur till your 50s, 60s, or 70s. So we want to address that energy gap as quickly as possible. Then over the long run, there are additional advantages. And one of them, for example, was published recently showing that when you exercise, you're actually getting improvements in the brain in a number of areas, but without even though you may not change blood access. Now, of course, you're getting improved blood flow, et cetera, but there are other things. There are soluble factors, for example, production of ketones, that are actually happening. So ultimately, you want to make your own. Because there are even, because again, there are advantages to endogenous ketosis. One of the things also, it has a nice anti-inflammatory effect that is not nearly as pronounced with exogenous ketones. So, address the gap immediately by giving yourself the energy, but over the long haul, get into the better way to produce ketones, which is endogenously.
And there, like that effect, there is a difference. And you talk about this too. I want to you to introduce your Keto Flex 12-3
Yeah. So
program.
yeah, and again, here's the idea. I'm not a nutritionist. I'm a neuroscientist. So we're simply looking at what is the best biochemistry we can get for you to make and keep synapses and to reverse. You're on the wrong side. Everybody we see who has cognitive decline is on the wrong side of that balance. We want to do everything possible to increase the synaptoblastic signaling and decrease the synaptoclastic signaling. And that's where we're seeing these just striking effects. So what is the diet that does that best for you? Okay, so this is why we call it Keto Flex 12-3. You want to hit several parameters to get the best outcome with your neurochemistry. The first thing you want to do is you want to be in mild ketosis. And typically we recommend between 1.0 millimolar and 4.0 millimolar BHB. Now you have to prick your finger to do that. So if you want to do a breathalyzer, you want to get, for example, Biosense has a nice breathalyzer that we've just evaluated recently. And I've not paid anything by Biosense, but Biosense has one where they measure what they call ACEs because you're measuring acetone. You want to be above 7 on the ACEs there, which is equivalent to the 1.0 to 4.0, even above 10, hopefully. So you want to get yourself, that's the first piece. You want to have a ketotic, a ketogenic diet. Second piece is it's flexitarian. Now I realize flexitarian has very specific meaning. So a flexitarian is not allowed to eat no meat. That's not the way we were using it here. The way we were saying here is if you want to be a vegetarian, fine, no problem. By the way, vegetarians have higher homocysteines. Please check your homocysteine. Please make sure to get it down. You got to check your vitamin D and things like that. But the bottom line is fine to be a vegetarian or a vegan. It's fine. This is a flexible diet. You can have some meat, have some protein, have some pastured eggs, have some grass-fed beef, have smashed fish, salmon, mackerel, anchovies, sardines, and herring. Those are all great. Don't have the high mercury fish. They are actually damaging your brain. Mercury is one of the best ways to produce an Alzheimer's state. Literally, you inject it into a brain, you get the plaques and tangles that are associated with Alzheimer's disease. So stay away from the high mercury fish. And then, so that's the keto flex piece. And then 12-3 means specifically you want a minimum of 12 hours between finishing dinner and starting breakfast, brunch, or lunch. So if you finish at 7:30, please don't eat breakfast before 7:30 a.m. If you're ApoE4 positive, you want to extend that to 14 to 16 hours because you are a better absorber of fats and it takes more time. During that time, you'll increase your ketones, you'll increase your autophagy, you'll allow your lymphatics to remove the debris, the damaged proteins, damaged lipids, damaged carbohydrates from your brain. So it's critical to get that in there. And as you know, just intermittent fasting has had so many positive things, improves your blood pressure, improves your detoxification, things like that. So that's the Keto Flex 12 and then /3. You want to have at least 3 hours between when you finish your dinner and when you go to bed. So you don't want to eat right up until bed because you're spiking your insulin. One of the best things I think that's come along in the last few years is continuous glucose monitoring, CGM.
Love
Stick
it.
it on your arm or you stick it on your gut, on your belly, whichever you like. Depends on whether you like whether you like the Abbott one, the Freestyle, or whether you like the Dexcom, whatever you happen to like, fine. People are seeing that when they spike their glucose, as you know, bad for your brain, but also when they then go to bed, it's drifting down. And we have people who are reporting, oh yeah, I wake up every night in the middle of the night and guess what? My glucose is 45. So if you're not eating that high fat, high fiber diet that smooths out your glucose. Then you're spiking it, and now it's going down into the trough. And both of those are horrible for your brain. You don't want to spike it up. You don't want it to go down rapidly, wake you up in the middle of the night. You're literally, again, now you're back with an energy gap in the middle of the night. You want to smooth it out. So that's why we recommend Keto Flex 12-3. Don't get your insulin up right before you go to bed. Very bad idea for your brain. And I noticed, interestingly, there's just a paper published on the Mediterranean diet, but they made a very important point. When they saw improvement, it was then a, quote, ketogenic variant of the Mediterranean diet. So the standard one isn't particularly good for putting you into ketosis. Ketosis is a critical part of best outcomes for neural connectivity. So that's why KetoFlex 12-3, it's essentially figured out and focused on the biochemistry of synapses.
Yeah, no, and I would say too, when we're looking at those Mediterranean diets, and many of the religions and cultures have extended fasting built into their culture, right?
Yeah.
I would say, for Catholics, fasting until after communion and things like this. I mean, it was built into the culture to get into a ketotic state, which gives us this higher, level of brain clarity and cognition and spiritual connection.
And people have noticed that for years and years and years. And of course, there's Ramadan, another example where people don't eat all day. So yes, you're right. Virtually every group has figured out, hey, there's something good about fasting.
I think you just gave me this great mnemonic to remember uh, the fish that we're allowed to eat: smash fish.
Yes,
Smash fish. So that was salmon, mackerel, anchovy, sardines, and herring.
exactly. Yeah, stay away from the large-mouth, long live fish, the tuna fish, the swordfish, the shark. These are the guys that are high on the food chain and have been eaten away for years and years and have accumulated these very high levels of mercury. They're the ones that are very damaging.
When we're healthy, a little bit, right? That
Yeah.
seagrass and tuna, oh my gosh, sushi all around. Yeah.
So I had a great patient several years ago called me up and said, I've just been given a diagnosis of early Alzheimer's. And we went through his story, and I said, look, you're in your early 50s. You sound like you have type 3. So we have subgroups of the Alzheimer's you can see with metabolic profiling. If you've got type 3, that means that you have some toxin. Let's figure out what the toxin or toxins are. And so this guy, I can't, I live a really healthy life, et cetera. Well, it turned out this guy had been very successful as a businessman, and he decided he wanted to have tuna sushi multiple times every week. He also just turned out to have very poor detox apparatus. So he ended up having the highest mercury that the lab had seen. If you look at 95th percentile, he had 7 times the 95th percentile, just off the charts. And he's done well. And interestingly, then I told him, look, we're not done. We need to find other toxins. No. We found it. I'm on it. Well, it turned out he also ended up having high levels of mycotoxins. So 2 different toxins, both contributing to his cognitive decline. He already had a PET scan that was diagnostic for early Alzheimer's disease. And he's done very, very well by approaching the correct things, by getting the appropriate detox. So
Yeah.
as you say, yeah, every once in a while, fine, absolutely. But don't let yourself get, don't let it go so much that it's actually building up and giving you brain problems.
Yeah, no, absolutely. And that's the whole test, don't guess, right? And you talk about additional testing for mercury, heavy metals, and how critically important that is. It's a topic we've covered in this podcast a little bit, but it is, cannot, emphasize how important it is to test and stool testing. So for our listeners, functional medicine docs will guide you in this testing. I mean, it is important. One other thing that you talk about, and I really like this, that I say this a lot, when we break fast, we want to detox, we want a detoxing beverage because our body, but we want to detoxify when we're breaking fast. Our body is detoxing all night, right? We are releasing toxins. So supporting it, I tell my clients, when we wake up, a tall glass of alkaline water, a shot of my Mighty Maca Plus, just let's get these things in to detox the body. And you talk about this as well. Break the fast with a detoxifying beverage.
Absolutely. And yeah, some people like to use lemon water, some sort of citrus water, often a good way to go. And so
But
you're
this
right.
lemon water, I'm sorry to interrupt, but just lemon water is not technically, I mean, you're still producing ketones with lemon
Yeah,
water.
absolutely. So you're right. At that time, you're not breaking the fast. And again, as an example, we have Julie writing in there about her own approach. She typically doesn't eat until about 1 or 2 p.m. Now, some people that's a little too long for them, no problem. As long as you're getting yourself into some ketosis, and yeah, you can liberalize once a week and cycle, no problem. So you're right. When you do want to think about what sorts of things can be detoxifying, for years and years and years, I was taught the healthiest thing to do in the morning is you get up and you have a big glass of orange juice. And of course, it turned out that's the worst thing I could have been doing because no better way to spike your glucose than to take a big slug of orange juice. And we had trees actually on our property. We would go out and take the orange trees, and I just loved making this orange juice and would just drink it, by the pint. Oh my gosh, it just I finally realized how bad that actually was for me over those years. So you don't want to spike your glucose. That's the last thing you want to do in the morning.
Yeah. So then, with that, when can you have orange juice?
Yeah, that's a great point. You got to be very careful because of the fact that it is such a high glycemic food. Preferably, you don't want to have orange juice. Preferably, you want to have low glycemic fruits. And as has been pointed out, fruits were something that appeared at the end of the summer. It's part of gaining weight. If you want to gain weight, that's when you want to have fruit. But if you're not wanting to gain weight, then you don't want to have a lot of fruit. If you're going to have some, fine, have some berries, have some low glycemic fruit. So there's a really interesting paradox. If you look at human beings, you look at their dentition, you look at their jaw structure, you look at their GI tract, and you say, is this organism a carnivore or an herbivore? As you know, it's not really a carnivore. We don't have the gut of a cat. It's not really an herbivore. We're not like an ungulate either. It actually fits best with what's called a frugivore. So in fact, the paradox is we're constructed to eat fruits, but the problem is all the fruits we're now exposed to are extremely high in sugar. Because people want to sell fruit, they want to make money, they have bred these fruits, things like these various apples that are so high in sugar and oranges and things. So the paradox is we're here on earth to eat fruits, but not to eat the fruits that are currently on earth. That's the problem. And so we do need to go toward a low glycemic. That's what all the different diets agree on, that one fact. It's got to be low. Sugar is killing us. The exposure to processed foods is killing us. These are the things that are actually hurting us the most. And yet, this is the way most of us are living. So, as I mentioned in the book, the problem is that virtually our entire species is attempting to live in a way that we were not evolutionarily designed to live. And in so doing, we're creating hypertension, we're creating metabolic syndrome, we're creating Alzheimer's disease, we're creating leaky gut, and just go right down the list.
Yeah, yeah. And one, just to wrap up, I want you to address oral hygiene and oral health and how that affects, because like, you talk about root canals in the book and amalgam fillings, and that's delivering mercury to our brain. So what is one to do when you're at that point? You have root canals and mercury fillings.
Is such a great point, actually. And when pathologists look into brains, they've been telling us for years two things about the brains of patients with Alzheimer's. The first thing that they told us is if you look at the brain, in fact, you ask, are there organisms in there when you have Alzheimer's? Guess what? They find all sorts of organisms. And now, in fact, it's controversial still, but there's discussion about whether there is a normal microbiome for the brain, something that shocks me because in medical school, of course, we were all taught the brain should be a sterile organ. So the jury's still out on this, but it's very clear that in Alzheimer's brains, you find P. gingivalis which is associated with periodontitis. You find F-nucleatum, T-denticola, P. intermedia, all associated with periodontitis. You find herpes simplex 1 from the lip. You find HHV6A, which is another herpes family virus, which appears to come in through the sinuses. And interestingly, the pathologist, the second thing they told us, that the distribution of Alzheimer's disease looks as if it's something that came in through your nose. So this whole area, rhinosinal and oral microbiome, is related to your brain. Who knew? So the idea that, oh my gosh, this stuff is communicating. Well, we now know the gut is communicating very clearly. Well, it turns out oral and rhinosinal areas are also communicating with your brain. So unfortunately, when you've got poor dentition, you are increasing your risk for cognitive decline. And there's something you can do. You can do things, for example, like dental Sidon, toothpaste and mouthwash. There
Love
are
it.
also, yeah, there are also now probiotic toothpaste like Revitin and others that can improve your microbiome. So we recommend that people get oral DNA test, check to see what your microbiome is. And as you indicated, it's root canals, it's mercury, it's periodontitis, it's gingivitis, so-called leaky gums. So leaky gum syndrome, just like leaky gut syndrome. So all of these things are potential contributors to cognitive decline. Therefore, it's critical to deal with these. And you want to go to an appropriately trained dentist or so-called oral systemic specialist.
Biologic dentist. And, this is such an important area. And you're talking about this rhinosinal area. I know that there's a lot of mycotoxins, right?
Yes.
Yeast, fungal sinus infections that are constantly treated with, um, antibacterials or antibiotics. And also like the nasal sprays that are steroid nasal sprays that basically feed yeast.
Yeah,
And I
it's
wondered your opinion on that.
yeah, such an important point. And an interesting study was done just a couple of years ago with now this was a rodent study, but it was very implicative. So what they did was say, okay, the blood-brain barrier is supposed to keep all these things out. Let's just see what happens if Candida, we're all exposed to Candida gets into your bloodstream. Okay, and these things, again, you get these things in bloodstream all the time, all sorts of things, anything from a teeth cleaning and things like that will get various organisms into your bloodstream. And so the thought was, okay, let's see how long the Candida stays out from the blood-brain barrier. Well, it turns out the Candida crossed the blood-brain barrier immediately. And it's set up, and so the brain responded, said, I'm being invaded. And guess what it did? It looked like the earliest changes of Alzheimer's disease. So literally, again, we are responding to these ongoing threats and ongoing insults on a daily basis. And you mentioned the molds and mycotoxins. When we first came up with the protocol to reverse cognitive decline, there was a group of patients that just simply didn't respond. And we were wondering, they look different. They were different age. They tended to be on the younger side. They tended to have a non-amnestic presentation. They often had some depression as part of their presentation. And I remember years ago having seen something actually on an ID channel on television about a man who became demented because he was exposed to Stachybotrys. And I thought, is it possible these people who are not responding, maybe these are people who are toxic? So we started talking to the spouses and started measuring the various toxin levels. And sure enough, these are the people that turned out to have what we now call type 3 toxic Alzheimer's disease. And there are the toxins, as you know, three groups of toxins. It's the inorganic toxins like mercury and air pollution, another big one. The California fires are going to increase our risk for Alzheimer's, unfortunately. Second is the organic toxins, formaldehyde, things like benzene, toluene, people who are exposed to high paraffin candle burning, people who are exposed to the World Trade Center, by the way, are at markedly increased risk for cognitive decline. And then the third group, which is the biggest group, is biotoxins. So as you indicated, we're exposed to these molds. We don't even know it. And there are the big five. So there's Stachybotrys, Penicillium, Aspergillus, Wallemia, and Chetomium. Those are the big five. And so you want to know what they're doing is they're fighting for their own survival They've got to fight the bacteria because the bacteria grow faster than the molds. So what they do is they make stuff that kills the bacteria. That's where we get penicillin, of course. Unfortunately, they also make toxins that damage the nervous system, damage the immune system, damage your kidneys, can give you increases in cancer. It's really sad. And so there's a wonderful, simple test you can get, which comes through the EPA, Environmental Protection Agency, so-called ERMI, E-R-M-I,
Yes.
relative mold index. Find out if you've got exposure to these specific species. You can also do one called Hurts Me Too. Any of these things just to get an idea. And then you can check your urinary mycotoxins. Find out if you have high exposure to these various mold toxins, because they can absolutely be critical players in cognitive decline. There's just no question about it. And when we reverse that, when we now detox from those things, that's when people begin to get better.
Yeah, and stool testing for mycotoxins as well. Yeah,
Absolutely.
this is so powerful. And ERMI testing, you guys, if you have just to for our listeners too, ERMI testing, ERMI, you can look that up, but it's different than often when you ask for mold testing in your home, they're doing something different. ERMI testing, you can order it, do it yourself, right, Dale?
Absolutely. So you can do things. There's a Mycometrics is one way. You can just go online. Mycometrics. They send you a little, like a little duster sort of thing. You can collect samples, send back to them, and they'll tell you what different species are there. Many mold species aren't making these toxins, but the big five that I mentioned, unfortunately, can produce high levels of these toxins.
And also clients with Candida, that brain fog. So you just explained that it crosses the blood-brain barrier. And
Yes.
yet often for menstruating clients, we get a surge in mold numbers in the, right around the cycle,
Yeah.
right premenstrual. And that can also increase anxiety, depression, mood swings.
Absolutely. So this is, we have to remember this is a dynamic situation. Your brain and you as an organism have this ongoing, you're getting insults. What we want to do is make it so the insults aren't overwhelming your ability to deal with them. That's what's happening when you have cognitive decline. Let's get the insults down and the ability to deal with them up. And now you're on the right side. And just as Dean Ornish showed years and years ago with atherosclerosis, when you're doing the right things, you're actually seeing a shrinkage. You're actually going the right direction. And we see the same thing with the brain. When you're doing all the right things, you're now laying down and keeping new synapses. When you're on the wrong side of that balance, you're just going to get worse, worse, worse.
So much powerful information and so much hope, right? Providing so many people with hope, whether you're genetically predisposed or not, right? We all have brains and we want to keep them as healthy as possible. And everything in your book, I mean, the End of Alzheimer's program is very practical and very funny, by the way. Thank you for infusing your humor into it. I mean, even your oral chapter, what was it to the
The whole tooth and nothing but the tooth.
yeah, the whole tooth and nothing but the tooth. Let me just name it. It's just fun. It's like, what's next? What's he going to say next, you guys? So I love that aspect, and plus so much hope and everything we're doing, like in this and the Keto Flex and the Keto Green, it is creating that. It's a natural vaccine to the pandemic of Alzheimer's, the pandemic of immunoinsufficiency, to really create resilience in each of us. And we're never too young and never too old.
Absolutely. And, we can make Alzheimer's a rare disease with the current generation. There's no reason that that can't be done now. If people get on the appropriate prevention or reversal, in fact, that can happen. And, our children should not be exposed to this stuff. They should make this, it's such a rare disease that, you would rarely see this happening. Right now, it's, of course, the third leading cause of death in the United States. So there's a tremendous amount we can do before it bankrupts Medicare, for example. That's one of the upcoming impacts of Alzheimer's in the next 15 years. So there's so much we can do, and there's absolutely hope, no question about it.
Well, I thank you. Just ask you a question. So, as the girlfriend doctor, I always want to know, like, how do you start your day?
Yeah, that's a great point. Typically, I just getting up, getting some exercise. I like organic psyllium husk. So first of all, I'm fasting from the night before and continue typically until around noon. So I'm typically doing an 8-hour feeding window and 16 hours without. and then try to get some exercise in the morning. Do organic psyllium husk, and then I typically do some citrus water, just for hydration, because that's such an issue. And I'm sure I don't do everything perfect. And one of the points of our research was that once you get over a certain threshold, things are going in the right direction. And so there's a lot. You don't have to do every single thing. Yes, biochemically it's overwhelming. There are dozens and dozens and dozens of things. But the good news is once you get over that threshold, things start to go in the right directions. So typically I have the organic psyllium husk. I have some citrus water. I do some exercise. And interestingly, if I've fasted for a long period, I may take a little ketone ester or ketone salts, just to get my own ketosis up. And you can notice, I mean, whoa, it's a kind of a rush. It's like, well, you're really sharp, and things are going very, very well. Now, again, in the long run, you want to keep that to a minimum. I rarely use it, but it's good to have it there.
Yeah, I agree. All right. So my second girlfriend doctor question is, how do you keep healthy relationships, or in your case, your romance sizzling hot?
Wow, that's a great question. And I wrote in the book about actually someone that I knew very well, who was a professor, a real gentleman, just one of my favorite people, who, when he began to get older, started having fights with his wife. Very much what you talked about, this physiological. They never did get divorced. But he actually hit her once, which had never happened for his entire, I mean, it was just completely out of character. And it turned out when he was evaluated, he was in the early stages of Lewy body dementia. And unfortunately, he succumbed to Lewy body dementia. And I always had said to him, please let us tune things up for you. This was when we were first beginning to understand this. Let us do the right things for you. He said, no. He was a religious guy who said, I don't believe in that. I'm just going to, this is God's will. So he didn't do anything. And to be fair, we didn't know nearly what we know now. But it just showed how much relationships are impacted by physiology, just what you were saying before. So, so my wife and my wife is an integrative physician. So interestingly, over 25 years ago, when we were just starting our research, she said, whatever you guys find in the lab is going to have something to do with basics, things like, what you're eating and how you're sleeping. And of course, at the time I said to her, no, I was very classically trained. And I said, no, we're going to find one fold of one protein, and we're going to develop a drug that just gloms onto that one fold, and poof, everything's going to be fine. Of course, I should have listened to her 25 years ago. So the things that we love to do, we actually like hiking. The hills in Marin are just amazing. Beautiful views of the water, beautiful views of San Francisco, the Golden Gate Bridge, the bay. And we take our dog and get up in the hills. I really like doing that. I really like we play pickleball, go up and hit it around, and tennis. Great to hit and run around. And then, we like to go out to dinner, and we like to go out to movies and plays. And of course, this has all been shut down with COVID-19. So it has really, what we liked to do. And of course, you mentioned hot. I mean, that has to do with, I won't even get into various clothing items and things. I'm not going to go there. But just to say, the things that we love to do, to go to dinner together, to go to a film together, to go to a play or something like that, or music, is gone. And so we're very much now sheltering in place. We get out, we still can get on a hike, which I think is really exciting and wonderful. And we can do those sorts of things, and having more home cooked meals, and more wonderful organic. And she has a wonderful organic garden here, which is fantastic. So all of those sorts of things that we enjoy.
I think that's great. I think it's also so important to focus on our relationships, our closest relationships,
Yeah,
because that is the most powerful medicine is oxytocin, right? The most
yeah,
powerful drug hormone in our body, and for our brain, and for our mood, and for our relationships. So being able to really like create uh, an emphasis in our life to keep our relationships strong and healthy, and knowing what what helps us do that is really powerful. I want to thank you so much for sharing so much of your wisdom today. I know my audience is going to hit replay and play this again and again and share it. Please tell our audience how we can get a hold of you, and also your program that you have, really customized, personalized medicine program that you also have.
Absolutely, yeah, and we've trained 1,500 physicians now. We have another 600 that are just waiting for this next one to come up. So we've got a lot of people out there that are practicing the protocol, and you can find out all this if you go to drbredesen.com or if you go to mycognoscopy.com, because we recommend, just as everyone knows, get a colonoscopy. And we've heard so much about this, especially with poor, unfortunate Chadwick Boseman, who just passed away with colon cancer. So please get a colonoscopy when you turn 50, but please get a cognoscopy if you're 45 years or older. You can go to mycognoscopy.com, and then you can also look on Facebook, Dr. Dale Bredesen. Any of those can get in touch with us.
So yeah, you're on social media everywhere. You've got Facebook, Instagram, then drbredesen.com and mycognoscopy.com. I was checking out that website, and you also have an app that goes with that program too. So I think it just making it accessible until now, right? Until now,
Absolutely.
we have, to get even a fraction, a portion of this level care is to find someone who's had functional medicine, integrative medicine, bioidentical hormone medicine training. So being able to have this resource and your book, where everywhere books are sold, the End of Alzheimer's and the End of Alzheimer's program, the latest release. I mean, it's really fabulous. Everyone needs this. Everyone needs to take a look at this. Get this book on your bookshelf in your hands. Follow the program, the concepts around it, and so many good things. Plus, the table of testing and the table of food choices. We're so in line. And also that you put in herbs. You put maca in there too, which is of course my favorite superfood. So it's really, all your work is tremendously well done, and still the Buck Institute research is ongoing.
So yeah, and I would make one more thing, which is that please everybody get on prevention. Let's make this a rare disease. And so we just have released a new thing called Precode for prevention of cognitive decline. Recode is for reversal of cognitive decline. And so Precode just came out. If you go to myprecode.com, you'll be able to see this. And this is for people who are asymptomatic and want to get on prevention. And if no surprise, the prevention is simpler than the reversal. So it's relatively simple to do, but gives you some optimal approaches. And so as far as the Buck is, so now I'm emeritus at the Buck. I was the founding president there, but now I'm emeritus because we've now moved from the fruit flies and the mice and the cells to humans. And so that this was always the hope, that we would understand the neurodegenerative process in enough detail that we could actually translate this. So I have to say the best thing about this has been seeing people get better, having wonderful emails and wonderful phone calls and reports from people who have gotten better. It's just been great. And let's take this so that the whole world, we reduce the global burden of dementia. That's the key.
Yeah. Thank you so much. I agree with you. And the fact, very emphatically, a reversal of Alzheimer's, right? But often people get a diagnosis and they're like, I have to, it's just going to get worse from here. No, we can reverse this condition and just improve our overall health for us, for our family, for those where we care about in our life. And I like what you said, to create that this becomes a rare occurrence. So thank you so much for all your time today. This has been very, very, very powerful.
Thank you so much, Dr. Anna.
I know that was a really powerful discussion with Dr. Dale Bredesen, author of the End of Alzheimer's program, and how important this concept is, getting into ketosis on a regular and frequent basis, detoxing our bodies, addressing all aspects of our health, following this concept of creating more insulin sensitivity, and as it relates to our brain, as it relates to our neurologic and our neuroendocrine system at any age. So, all my Keto Green followers, it's like, okay, step it up a notch. We got to do this. And definitely, even following the Keto Green approach, read this book, The End of Alzheimer's program, is Keto Flex 12-3 plan. And just the the other aspects he brings into it with the heavy metal testing and the oral health and toxin exposure, and it can affect all of us in our lives, someone we know and someone we care about. Man, he said so many good things that this creates an energetic emergency. I love that. I love the concept of how we talked about hormones with also adding detox as one of the benefits for progesterone, and continuing to create a lifestyle of learning new things. As we learn new things, we create neuroplasticity in the brain. It's exercise for the brain to keep challenging ourselves to learn new things. And if we're struggling, we definitely want to start this preventive plan. So Dr. Bredesen, he has mycognoscopy.com, myprecode.com, everything at his website, drbredesen.com. And of course, add this to your library. Add, if you don't already, Keto Green 16, and add the End of Alzheimer's program to your library. I look forward to your questions because I know there was so much information here. Please email in your questions to me. Respond to this email. If you're on my email list, you can respond to any one of my emails. Add a comment or question, or email us at team@drannakabeca.com, team@drannakabeca.com. So I look forward to hearing from you. Please share this episode, and thank you. Thank you for being part of our world, our community, and the Girlfriend Doctor. And I look forward to talking with you next time. So bye for now.